Right now, as you're watching this video, your body might be sending you a life-threatening warning signal. If you don't recognize these 5 signs, tomorrow might be too late. But if you do recognize them, you could live 20 more healthy years. Hi there, I'm Dr. Michael Harrison. I've been specializing in emergency medicine and cardiology for 25 years. Today, I'm going to give you critical information that could save your life. According to American Heart Association data, 80% of sudden deaths in the 60-plus age group are preventable because the body sends warning signals 24 to 72 hours in advance. Here's the problem. We dismiss these signals as old age, fatigue, or it'll pass. By the end of this video, you'll recognize these 5 hidden signs and know when emergency intervention is needed. If this kind of life-saving information interests you, don't forget to subscribe to our Health Memory channel and turn on notifications. Section 1. The terrifying reality of sudden death. Last month, the family of 67-year-old Patricia Williams told me, "Doctor, I called Mom last night. She was fine. This morning, we couldn't find her." Patricia's situation is unfortunately one of the biggest threats facing the 60-plus age group. Sudden cardiac death. Shocking statistics. $350,000 suddens. People die from sudden cardiac death annually in the U.S. 80% of these are from the 60-plus age group. 70% of cases have warning signs beforehand. Only 10% reach the hospital in time. Main causes of sudden death. Sudden cardiac arrest. 45% massive heart attack. 30% aortic aneurysm rupture. 15% massive pulmonary embolism. 10% according to Mayo Clinic research. 80% of these conditions give advance warning. Heart attack symptoms 72 hours before aortic problems. Pain 48 hours before. Pulmonary embolism. Shortness of breath 24-hour verteden foderde 20 Trandauern. Cardiac arrest. Rhythm disturbances 4 to 6 hours before. Patricia seat. Missed warning signs. When we spoke with her family, we learned 3 days before she felt strange fatigue. 2 days before, she had nausea. 1 day before her death, left shoulder pain. In her last conversation, she said, "I'm a bit short of breath." If these signs had been recognized and she'd been brought to the emergency room, Patricia might be alive today. Section 2. First hidden sign. Unexplained fatigue. The first and most deceptive sign. Sudden onset of unexplained fatigue. This isn't normal fatigue. As defined by Harvard Medical School, fatigue so severe you can't do normal activities. Fatigue that doesn't improve with rest. Fatigue with no apparent cause. Fatigue lasting for days. William Thompson, Sioux. Story. At 75, he walked 5 kilometers every morning. One Monday morning, he told his wife, "I'm too tired today. I can't go for my walk." Tuesday, he said the same thing. Wednesday, his family insisted he see a doctor. His EKG showed minor abnormalities. Emergency cardiac catheterization was performed. They found 95% blockage in the main coronary artery. A stent was placed, and his life was saved. William was lucky because his family took 3 days of fatigue seriously. Scientific explanation. When the heart can't pump enough blood, the body protects priority organs: brain, heart, kidneys. Blood flow to muscle tissues decreases. Cellular oxygen deficiency begins. Mitochondrial energy production drops. Result: unexplained fatigue. According to Johns Hopkins research, 89% of the 60-plus age group who experienced heart attacks had 3 to 7 days of fatigue before the attack. Danger signals. Difficulty getting out of bed in the morning. Getting tired more quickly when climbing stairs. Wanting to stop daily tasks midway. Feeling, "I don't feel like myself today." Not wanting to get up from where you're sitting when to worry. Fatigue lasts more than 48 hours. It affects your normal activities. It doesn't improve with rest, accompanied by shortness of breath, combined with chest discomfort. Margaret Davis's experience. At 69, she went for a checkup after 4 days of fatigue. It was discovered she had experienced a silent heart attack. Thanks to early intervention, heart damage was minimal. Section 4. Third hidden sign. Atypical pain. A third deceptive sign: jaw, neck, shoulder, or back pain. Everyone expects chest pain during a heart attack. But in the 60-plus age group, heart pain mostly manifests in atypical locations. James Wilson's misleading pain. At 77, he had left shoulder pain when waking up. "I must have slept in the wrong position," he said. The pain continued throughout the day. In the evening, it spread to his jaw. He spent the night in pain. In the morning, he made a dental appointment. Fortunately, the dentist said, "This isn't tooth pain. Go to the emergency room." It was 18 hours of ongoing heart attack symptoms. Referred pain anatomy. The heart and other organs share the same nerve pathways. T1, T4 spinal segments. Heart, left arm, jaw, phrenic nerve. Heart, neck, shoulder vagus nerve. Heart, stomach, throat. Therefore, heart problems can create pain in these areas. Most common atypical pain locations. Left jaw pain, 45% of cases. Left shoulder arm pain, 60% of cases. Neck pain, 25% of cases. Back pain, 30% of cases. Epigastric, upper stomach. Pain, 35% of cases. Dangerous pain. Characteristics. Sudden onset, doesn't improve with rest. Increases with activity, accompanied by sweating. Nausea lasts more than 20 minutes, according to University of Michigan research. In the 65-plus age group, 40% of heart attacks begin with atypical pain. This rate rises to 70% in women. Diabetics may have no pain at all. Late diagnosis risk is 3 times higher. Helen Rodriguez's life-saving decision. At 71, neck pain began. She thought neck herniation relapsed, but the pain spread to her left arm. Her intuition told her it was something different. She went to the emergency room. EKG was normal, but troponin was elevated. She was diagnosed with NSTEMI, non-ST elevation myocardial infarction. She was taken to the catheter laboratory within 6 hours. Her life was saved. Special situations in women. According to Harvard Women's Health data, in women, chest pain is less common, 55% versus 85%. Atypical symptoms are more widespread. Fatigue and shortness of breath are prominent. Diagnosis delay is more frequent. Mortality risk is higher emergency criteria. If these pains are accompanied by any of the following, call 911 immediately. Cold, sweating, shortness of breath, nausea, vomiting, dizziness, palpitations. Section 3. Second hidden sign. Digestive problems, the second deceptive sign. Sudden onset of nausea, vomiting, or digestive discomfort. Most people think this is "I ate something bad" or stomach flu. But in the 60-plus age group, sudden digestive complaints can be a sign of heart problems. Robert Martinez's drama. At 72, he developed nausea after dinner. The fish must have been bad, he thought. Vomiting was added during the night. In the morning, his wife said, "Let's go to the doctor." He said, "It'll pass." In the afternoon, severe chest pain began. He was taken to the hospital by ambulance. He was having a massive heart attack. The nausea that started 16 hours earlier was caused by oxygen deficiency in the heart muscle. Scientific basis. During cardiac events, the vagus nerve is stimulated. The gastrointestinal system is affected. Gastric motility is disrupted. Nausea and vomiting centers are activated according to Cleveland Clinic data. 85% of women having heart attacks experience nausea. This rate is 60% in men. Risk is higher in the 60-plus age group. Digestive symptoms are more prominent in silent. Cardiac versus gastric differentiation. Cardiac digestive symptoms. Sudden onset, severe nausea, accompanied by cold sweating. May have chest-arm discomfort. Worsens with activity, normal digestive problems. Gradual onset related to food. May have fever. Localized abdominal pain improves with rest, Dorothy. Chen's lucky experience. At 68, nausea started at midnight. She went to the hospital in the morning. EKG showed signs of ischemia. Troponin was elevated. She recovered with minimal damage thanks to early intervention. Critical decisions. If sudden digestive complaints occur in the 60-plus age group, if lasting more than 2 hours, go to emergency room. If accompanied by sweating, chest discomfort, call 911 immediately. If you have known heart disease, don't delay. Don't wait thinking it'll pass. Section 5. Fourth hidden sign. Shortness of breath, the fourth critical sign. Sudden onset or worsening shortness of breath. We tend to explain this symptom as old age, weight gain, or poor condition. But in the 60-plus age group, sudden shortness of breath can be deadly. Carol Thompson's dangerous delay. At 74, she was getting short of breath climbing stairs. "We're getting old," she said. A week later, shortness of breath started at night, too. "Maybe I have asthma," she said. Days later, she couldn't breathe when waking up in the morning. She was taken to the hospital by ambulance. She was diagnosed with acute heart failure. Her ejection fraction was 25%, normal 55 to 70%. Doctors said, if she had come 2 weeks earlier, we could have controlled it with medications. Now more invasive treatments are needed. Anatomy of shortness of breath. Main causes of shortness of breath in the 60-plus age group. Heart failure, 40%, coronary artery disease, 25%, COPD exacerbation, 20%, pulmonary embolism, 10% arrhythmia, 5%. Cardiac versus pulmonary differentiation. Cardiac shortness of breath. Starts with exertion. Improves with rest. Worsens when lying down at night, accompanied by foot, leg swelling. May have palpitations. Fatigue is prominent pulmonary. Shortness of breath. Constantly present. Accompanied by cough, sputum, wheezing can be heard. May have fever. Doesn't change with position Framingham Heart Study. Findings. 60% of sudden shortness of breath cases in the 65-plus age group are cardiac. If not treated within 48 hours, mortality is 25%. With early diagnosis, mortality is below 5%. Symptoms may be more subtle in women. George Martinez's early diagnosis. At 68, mild shortness of breath began. His wife said it'll pass, but George listened to his intuition. He went to the emergency room. EKG showed AF, atrial fibrillation. Anticoagulant was started quickly. Rhythm control was achieved. He returned to normal rhythm after 24 hours. His doctor said if he had waited, stroke risk would have been very high. Situations requiring emergency intervention. Shortness of breath at rest. So severe you can't speak. Blue discoloration, cyanosis, accompanied by chest pain. Feeling of fainting, special risk groups. Diabetes patients, silent heart attack. Hypertension patients, history of previous heart attack. Family history. Sedentary lifestyle, according to American Heart. Association data, shortness of breath in these risk groups is 70% cardiac in origin. Section 6. Fifth hidden sign. Dizziness and fainting sensation. The fifth and perhaps most dangerous sign, dizziness, fainting sensation, or momentary loss of consciousness. This symptom is often explained as blood pressure dropped, blood sugar dropped, or got up too quickly. But in the 60-plus age group, sudden dizziness can be a harbinger of deadly arrhythmias. Anthony Davis's last-minute rescue. At 71, he suddenly felt dizzy while shopping at the store. He held onto the wall. "Blood sugar must have dropped," he said. On the way home in the car, it happened again. This time he almost fainted. His wife took him directly to the emergency room. Holter monitor showed ventricular tachycardia, VT episodes. The next episode could have resulted in sudden death, said the cardiologist. An ICD, implantable defibrillator, was implanted. The device intervened twice in 3 months and saved his life. Mechanism of cardiac dizziness. Heart rhythm becomes disturbed. Too fast, too slow. Heart pumping capacity decreases. Blood flow to the brain decreases. Hypoperfusion begins. Consciousness level drops. Critical arrhythmia. Types: ventricular tachycardia. High risk of sudden death. Atrial fibrillation. Stroke risk. Bradycardia. Heart block risk. Sick sinus syndrome. May need pacemaker, according to Mayo. Clinic statistics. 45% of sudden fainting cases in the 70-plus age group are cardiac. Sudden death risk is 5 times higher than normal population. If treated within 48 hours, risk decreases by 80%. Patricia Miller's lucky experience. At 69, she felt faint while bathing. 5 minutes passed. "It was from fatigue," she said. But it happened again the same night. She went for a checkup in the morning. EKG showed AV block, heart block. A pacemaker was implanted the same day. Her doctor said, if she had waited a week, complete heart block could have occurred. Dangerous versus harmless dizziness. Dangerous, cardiac. Dizziness, sudden onset. During activity, accompanied by palpitations, may have chest pain. Repetitive, harmless. Non-cardiac. Dizziness, with position change, slow onset inner ear symptoms. Vision problems related to dehydration. Statistical facts. According to Johns Hopkins data, in the 65-plus age group, 30% of those presenting to emergency with sudden dizziness have serious cardiac problems. 50% of those with fainting history have arrhythmias. 1-year mortality with recurrent dizziness is 20%. With early diagnosis, this rate drops to 3% emergency intervention. Criteria: call 911 immediately if these symptoms are present. Complete loss of consciousness, accompanied by chest pain, shortness of breath present. Palpitations continue. Speech disturbance. Section 7. Early intervention and emergency protocol. When to call 911. If any of these 5 signs are present and the following conditions accompany them, call emergency immediately. Red alert situations. Symptoms last more than 20 minutes. Getting progressively worse. Multiple symptoms together, accompanied by sweating, nausea, speech, chartunes, movement, difficulties present. First aid protocol. Aspirin protocol. If you're not allergic to aspirin, chew 325 lirdamine aspirin. Don't swallow. Don't take if using blood thinners. Don't take if you have stomach ulcers. Position. Comfortable, semi-sitting position. Loosen tight clothing. Ensure fresh air. Don't panic. Stay calm. Information. Preparation. What should be ready when ambulance arrives? Medication list. Allergy information. Last doctor visit. Symptom onset time. Previous cardiac problems. Barbara Wilson's perfect intervention. At 73, chest pain began. She followed the protocol. Chewed aspirin. Called 911. Prepared medication list. Left door open. Ambulance arrived in 8 minutes. She was in the catheter laboratory at the hospital in 45 minutes. The cardiologist said, perfect STEMI protocol. She recovered with minimal damage. Pre-hospital cardiopulmonary resuscitation. If person is unconscious. Check pulse, 10 seconds. Check breathing. If absent, Start CPR 30 chest compressions. 2 breaths. Use AED if available. American Heart Association statistics. Early CPR increases survival chance to 40 to 70%. Each minute delay causes 10% decrease. AED use doubles the chance. Section 8. Prevention strategies and long-term protection daily lifestyle changes. While it may not be possible to completely prevent these 5 signs, you can significantly reduce your risk. Nutrition strategies. Increase omega-3. Fish 2 to 3 times per week. Boost potassium. Bananas, oranges, nuts. Reduce sodium. Under 2,300 milliliters per day. Antioxidants. Colorful vegetables and fruits. Increase fiber. Whole grains. Legumes. Exercise protocol. American College of Cardiology recommendations. 150 minutes moderate intensity per week. 2 days strength training. Daily flexibility exercises. Gradual increase. 10% rule. Get doctor's approval. Frank Martinez's transformation. Story. At 69, he had a heart attack. Afterwards, applied nutrition plan. Started regular exercise. Managed stress. Took medications regularly. No problems for 5 years. Stress management. Chronic stress doubles cardiac risk. Meditation. 10 minutes daily. Deep breathing. During stress. Social support. Friends, church, family. Hobby. Activities you enjoy. Sleep. 7-8 hours quality. Regular follow-up program. For 60-plus age group. Cardiology check every 6 months. Annual lipid profile, EKG monitoring, blood pressure monitor. HTTU ATA-ABA1C for diabetics. Technology, support. Modern devices can save lives. Apple Watch, EKG feature. Blood pressure monitors. Sleep tracking devices. Medication reminders. Dorothy Chen's prevention. Success at 72 with family history of heart disease in parents. Applying prevention program. Daily walking 45 minutes. Mediterranean diet, stress management. Regular checkups. No cardiac events for 8 years, family and close circle. Education. Your loved ones should know these signs. Share this video. Make emergency plans. Keep contact numbers current. Keep medication lists ready. Dear Health Memory family, these 5 hidden signs can save your life. Unexplained fatigue. Digestive complaints. Atypical pain. Shortness of breath. Dizziness. Fainting sensation. Remember, your body warns you. Listen to it. Don't wait thinking it'll pass. When in doubt, go to emergency prevention is always better than treatment. If you liked this health memory video, don't forget to hit the like button, share your experiences in the comments, and subscribe. Your life is very valuable. Use this information and live 20 more healthy years. Wishing you healthy days.